I never supported these vaccines. I never told a single patient that it was safe to take a vaccine. I didn't take a COVID-19 vaccine myself because it wasn't safe. And I published an op-ed in The Hill in August of 2020, before they came out. The title of that op-ed is The Great Gamble of the COVID-19 Vaccine Pandemic. The reason why it was a gamble is because the vaccines, and of Americans who took the vaccine, is roughly 75% of Americans took at least one shot, according to the COVID States program. Of those, 94% took a messenger RNA vaccines. We can restrict our comments to messenger RNA vaccines provided by Pfizer and Moderna. These vaccines are a brand new technology that installs the genetic code for the lethal part of the virus, which is the spike protein, the spine on the surface of the virus. This was an extraordinary gamble because there was no knowledge of what was going to turn this off. Once the genetic code gets in the body, there was no knowledge of, does the body get rid of the genetic code? What shuts it off? Will some people produce too much genetic code and have it keep moving from cell to cell and too much spike protein? It was known then that the spike protein was lethal. And to give a genetic code for a potentially lethal protein that was devised in a Chinese biosecurity lab to Americans was the most dangerous proposition our government agencies could have ever put forward to our country. And what we've learned on this is extraordinary. Castriuta and colleagues has published the messenger RNA is physically circulating in the blood for at least 28 days. That's as long as they've looked. Crossan and colleagues from Harvard has shown the messenger RNA is stuck in the human heart 30 days after the vaccine when people die. And there's inflammation around it, presumably due to the spike protein. Rolkin and colleagues from Stanford have shown the messenger RNA is stuck in human lymph nodes for at least 2 months. And that's as long as they've looked. Now, the spike protein, which is produced by the messenger RNA, is widely circulatory in blood and shown by Harvard, by Ogata and colleagues, Swank, and recently Brogna in Germany. Now, Brogna in Germany looked 6 months afterwards, and at least half the people who took the shots had vaccine spike proteins circulating in their bloodstream. That's as long as they've looked. And they can identify it because Pfizer and Moderna have an amino acid signature on their spike protein to let us identify. We know that it's Pfizer and Moderna. It doesn't come from the natural virus. It's coming from the vaccine. That's proven. The spike protein now, in 3,400 peer-reviewed papers and growing, is proven to cause heart damage and myocarditis. Our regulatory agencies agree. Every regulatory agency in the world agrees. There's actually guidelines now in the UK and Australia about how to diagnose and manage vaccine myocarditis. That's how common this is. It accelerates atherosclerotic cardiovascular disease, causes tremendous swings in blood pressure and heart rate called posterior orthostatic tachycardia syndrome, or POTS, causes neurologic injury, stroke, both ischemic and hemorrhagic, paralyzing syndromes, including Guillain-Barré syndrome, small fiber neuropathy, ear ringing. It causes blood clots. The spike protein is physically found in blood clots. The largest blood clots that we've ever seen in clinical medicine, typically a blood clot that someone would get after a hip surgery or on an airplane, would be a centimeter or so. It's common in my practice. Yesterday, I saw patients with 15, 17, 2 feet blood clots in their legs. Oh my God. After the vaccine. We see blood clots both on the arterial side and on the venous side. This is distinctly unusual. The body is set up after the vaccine to form blood clots. And this is particularly harmful in people with a predilection to blood clots or other provocateurs, hip surgery, smoking, supplemental estrogens, prolonged immobility, etc. The fourth major category where the vaccines clearly cause injury and damage is autoimmunity. The human body recognizes the spike protein as non-human, and so the body attacks its own cells in an attempt to try to fight this, and because of this, the body then expresses markers of autoimmunity that now I routinely test in my practice: the antinuclear antibody, the ANA test, which is a test we do for systemic lupus, the anti-citrulated peptide test for rheumatoid arthritis, and then the ANCA test, the anti-neutrophil cytoplasmic antibody test. These are now all proven in the peer-reviewed literature. These blood tests turn positive in response to the vaccine, and people develop a variety of autoimmune syndromes. This is what we're seeing clinically. My observations are based in terms of what I'm seeing clinically, what I'm reading in the peer-reviewed literature. And in the peer-reviewed literature, large numbers of cases are being reported. I want to cite one paper from the peer-reviewed literature, Lane and colleagues, that's assembled now a series of 18,204 patients with myopericarditis. 18,000. Now, I can tell you, my whole career, I saw 2 cases before COVID-19. Now I am seeing myocarditis on a daily basis. The number of myocarditis cases in the United States before the pandemic was roughly 200 to 400 cases in the whole country per year. Now we're seeing this in the thousands, and these are limited sets. Now, of those 18,204 spontaneously reported cases, the death rate in these patients is 0.22. So fortunately, majority of people survive, but sadly, some die. In the published papers of people describing the cases, the death rate has ranged from 0.41 for myopericarditis to 45.9%. 45.9%. Hulscher and colleagues, of which I am a senior author on this paper, is now has a paper in the preprint server. Now it's been fully accepted to the European Society of Cardiology journal, has proven that myocarditis is fatal when autopsies are confirmed. When the doctors suspect myocarditis, there's a 100% rate of confirmation that it's fatal myocarditis. When there's general death that's occurred in a vaccinated patient, our data suggest that it's roughly 74%. If an autopsy would be done, it would be confirmed that the vaccine was the cause of death. Today, a Rasmussen poll is out, and the Rasmussen poll has shown that 53% of Americans think the COVID-19 vaccines are causing serious injuries leading to large numbers of, quote, unexplained deaths. So the word is out. I've made the call on the floor of with Senator Johnson and a panel in the U.S. Senate, multiple state senates, the European Parliament. I'm making the call today. The COVID-19 vaccines should be removed from the market. They're not safe for human use. Those are my comments. Thank you.
Thank you, Dr. McCullough.